Can I ask you something a little personal? Have you ever taken a vitamin, not because a doctor told you to, but because the label said it was good for your heart? Or maybe your neighbor swore by it? You wanted to feel sharper, stronger, and you thought, it's just a vitamin, it can't hurt. I've heard that sentence more times than I can count. And after 30 years treating stroke patients, I can tell you, sometimes the things that seem safest are the ones that hurt us most quietly. No pain, no warning. Just one morning, you wake up with your words slurred, or your balance gone, or your right hand refusing to move. And the worst part, it could have been prevented. I'm not here to scare you. I'm here because I've seen too many good, kind, disciplined people fall into a trap that no one warned them about. They were doing their best, but they didn't know the rules had changed after age 60.
You see, after 60, your brain doesn't process food, medications, or supplements the same way. The same pill that helped at 40 could trigger a stroke at 70, just because your arteries, your blood pressure, and your nervous system are no longer as forgiving. That's why today I want to walk with you through one of the most overlooked dangers I've seen in my practice: how common vitamins, taken with the best intentions, can quietly harm your brain, especially while you sleep. If you've ever wondered, could something in my daily routine be quietly hurting me? You're not alone. And this video might just change everything. Before we dive in, let me ask you this. Have you ever taken a vitamin and felt unsure if it's helping? If yes, comment the number 1 below. If no, type 0. I'd love to know what you think. And if this message resonates with you, please subscribe and tap the bell so we can walk this journey together toward better brain health, one habit at a time. Because here on Dr. Brain, we protect your brain before it needs saving. Number 1, the vitamin that was supposed to strengthen his bones, but ended up silently triggering a stroke. Let me tell you a story that still keeps me up at night. His name was Walter, 74 years old, a retired Navy veteran from North Carolina. He was proud, polite, and by all accounts, in great shape for his age. He walked every morning. He cooked healthy meals. He didn't drink, didn't smoke, and he took his vitamins every day like clockwork. That's what makes what happened to him so difficult to talk about. Walter thought he was doing everything right. Every morning, for over a year, he took 1 capsule of vitamin D, 10,000 international units. Not because a doctor told him to. He picked it up from a pharmacy shelf because it said, supports bone strength. And he wanted to protect his joints as he aged. But one morning, his wife found him slumped on the couch. He couldn't move his right side. His words were jumbled. His eyes looked confused. Walter had suffered a stroke. And the reason? It wasn't high blood pressure. It wasn't smoking. It wasn't bad cholesterol. It was vitamin D. We ran his blood work. His calcium levels were dangerously high. His arteries had become stiff. His blood pressure had spiked overnight while he slept. This wasn't random. This was vitamin D toxicity, a condition that slowly builds up over time when you take too much of this fat-soluble vitamin. You see, vitamin D helps your body absorb calcium, but if you take too much, more than 4,000 international units per day, your body doesn't just use that calcium to strengthen bones. It sends that extra calcium into your bloodstream, and over time, your arteries start to absorb it. They harden, they narrow, they become fragile. Now, imagine this happening slowly, silently, day after day. No pain, no dizziness. Until one night while you sleep, all the conditions line up. Stiff arteries, low hydration, and a blood pressure spike. And the stroke strikes without warning. Here's what many people over 60 don't realize. Vitamin D is fat soluble. That means it does not flush out of your system like vitamin C. It builds up.
Most over-the-counter bottles you buy today contain 5,000 to 10,000 international units per capsule, far beyond the recommended dose for seniors. The National Institutes of Health recommends only about 600 to 800 international units per day for older adults, unless you have a medically diagnosed deficiency confirmed by a blood test. Taking vitamin D at night is even riskier. That's when your blood pressure naturally fluctuates. That's when your calcium metabolism slows down. If your arteries are already aging, it's like striking a match near dry leaves. Walter survived, but he walks with a limp. He can't drive anymore.
And I will never forget what he told me during one follow-up visit. I thought I was protecting myself. I didn't know I was setting a trap inside my body. My advice is simple. Do not take high-dose vitamin D unless your doctor has tested your blood and told you to. And never take it at night, because more is not better. Not after age 60. Now let me ask you this. Have you ever bought a vitamin without checking the dose on the label? If yes, write the number 1 in the comments. If not, write 0. I want to know how many people out there are like Walter, just trying to do the right thing. Number 2, the vitamin that promised to protect her heart, but made her brain bleed. Evelyn was sharp, 81 years old, a retired librarian from Ohio. She loved crossword puzzles. She drank green tea every afternoon. She had a quiet routine that she had refined over decades.
One part of that routine, a natural vitamin E capsule. 800 international units every single day. She took it to protect her heart. She read that it helped circulation. It said natural antioxidant on the label. What harm could it do? But Evelyn had another condition. She had atrial fibrillation, a common heart rhythm disorder in older adults. To prevent clots, her doctor prescribed warfarin, a blood thinner. Her lab results had always been steady, until one day they weren't. One evening, Evelyn complained of a headache. Her daughter thought it was just a migraine. But hours later, Evelyn started slurring her words. She became confused, then began vomiting. They rushed her to the hospital. The scan confirmed it. A hemorrhagic stroke, bleeding inside her brain, not from a fall, not from high blood pressure, but from over-thinning her blood. The hidden culprit, vitamin E.
Most people don't realize this. In high doses, vitamin E acts as a natural anticoagulant. That means it slows blood clotting, just like warfarin. So when Evelyn combined both, even unknowingly, her blood became too thin. And in the fragile blood vessels of the aging brain, that is a recipe for disaster. You might be thinking, but it's natural. Yes, but natural doesn't always mean safe, especially not when combined with prescription medications. The recommended daily intake of vitamin E for older adults is about 15 milligrams, or roughly 22 international units. Yet most supplement bottles contain 200, 400, or even 1,000 international units per pill. No warning label, no one-size-fits-all caution. And no one told Evelyn that heart healthy might mean brain risky. After her stroke, Evelyn's short-term memory never fully returned. She walks with a cane. And she told me with tears in her eyes, "I just wanted to protect my heart."
I didn't know I was making my brain bleed. And that's what breaks my heart most. Not just the injury, but the intention behind it. She didn't do anything reckless. She just wanted to stay independent, like so many others. My advice? If you are taking blood thinners like warfarin, Plavix, or even a daily aspirin, do not start vitamin E without talking to your doctor. Not even if the bottle says natural. Because what's natural can still be dangerous. Let me ask you this. Do you currently take any supplements for your heart or circulation? If yes, comment the number 1 below. If not, write 0. I read every comment, and your experience might just help someone else avoid danger. Number 3, the vitamin that promised to strengthen his nerves, but slowly took away his balance. His name was Harold, 76 years old, a retired truck driver from Kansas.
He had spent decades hauling cargo across state lines, long nights, strong coffee, and a body that never quit. When he retired, Harold wanted to do everything right. He started eating cleaner, walking more. He even bought memory supplements online, hoping to stay sharp and energetic. One bottle caught his eye. It promised to boost brain performance, enhance nerve strength, and fight fatigue. The key ingredient? Vitamin B6. Each tablet contained 100 milligrams. Harold took 2 a day, every day, for more than a year. At first, nothing seemed wrong. Then he began waking up with numb fingers. He said his legs felt like they were missing the message. He stumbled more, dropped things. Then one morning, he fell in the bathroom and hit his head. His blood tests came back normal. No diabetes, no stroke, no obvious explanation, until I looked at his supplement list.
Harold was consuming 200 milligrams of vitamin B6 per day, 10 times the upper safe limit for older adults, which is about 20 milligrams total per day from all sources. Here's what most people don't know. Vitamin B6 is essential in the right amount, but in high doses, it becomes toxic to your nerves. It strips away the protective layer called myelin, the coating that helps your nerves send signals properly. Imagine an electrical wire without insulation. The signal gets weaker, then scrambled, then gone. In Harold's case, the nerve damage had already started. We stopped the supplements immediately. With therapy and time, the progression slowed, but it never fully reversed. He no longer drives. He walks with a cane now. And during one appointment, he looked at me and said, "Doc, I just wanted to stay sharp. I didn't know I was poisoning myself." That's what makes this so heartbreaking. The bottle didn't say warning. It didn't say nerve risk. It said doctor formulated. It said safe and natural. But the truth? No supplement is safe in high doses, especially not vitamin B6. Let me ask you, have you ever taken a memory or nerve supplement without checking the dosage? If yes, leave a number 1 in the comments. If not, write 0. And let others learn from your care, because sometimes the danger isn't what you feel. It's what you don't. Number 4, the vision vitamin that raised brain pressure like a silent tumor. Dorothy was elegance in motion. 79 years old, a retired piano teacher from Oregon. She still played Beethoven by memory. She taught neighborhood kids how to read sheet music. She had clarity in her thoughts, and grace in her movements. And she had one small ritual every morning. She took a supplement that promised radiant skin, strong vision, and graceful aging. It contained 10,000 international units of vitamin A. She took it faithfully for almost 5 years. The label said natural beauty formula. It sounded gentle, safe, promising. Then the headaches started. At first they were mild, then came the blurry vision, then the dizziness. One afternoon, she slurred her words during a phone call. Her daughter thought she might be having a stroke, but the brain scan showed no clot, no bleeding. What we found instead was something even more alarming: increased intracranial pressure. In other words, her brain was under pressure, as if a tumor were growing inside. But there was no tumor. This condition is known as pseudotumor cerebri, or false brain tumor. And the cause? Vitamin A toxicity. What most people don't know is that vitamin A is fat soluble. It doesn't flush out like vitamin C or B. It accumulates in your liver, your fat, and eventually your brain.
The safe upper limit for older adults is around 2,500 to 3,000 international units per day, including what you get from food and multivitamins. Dorothy had unknowingly consumed more than 3 times that amount every single day for years. Here's why that matters. When vitamin A builds up, It increases cerebrospinal fluid pressure. That fluid surrounds your brain and spinal cord. Too much pressure, and it begins to push on your optic nerves, your brain tissue. And just like a balloon that swells beyond its limit, something eventually gives. Dorothy was lucky. We caught it in time. We stopped the supplement. She underwent spinal taps to relieve pressure, but her balance never fully returned. And her eyesight, she described it like looking through fog that never lifts. I thought I was doing something good for my body, she told me. I didn't know I could be hurting my brain. And that's the lesson I hope no one ever forgets. Vitamin A is essential, but in real food portions. Carrots, sweet potatoes, spinach, your body knows how to manage those. But when you add high-dose pills on top of your daily meals and multivitamins, you may be stacking danger, one soft gel at a time. Let me ask you, have you ever taken any skin or eye supplement for more than 3 months straight? If yes, comment number 1. If not, write 0. And if you have that bottle nearby, check how much vitamin A is in there. You might be surprised because vision doesn't just come from what you see, it comes from what you believe. And I believe your brain deserves better than a silent risk. Number 5, the cholesterol vitamin that triggered a mini stroke before breakfast. Frank was the kind of man who woke up before sunrise, 82 years old, a retired postman from Florida. He still wore his old postal jacket when the weather turned chilly. He believed in walking every morning, staying active, and doing things the natural way. He had read somewhere, maybe in a magazine at the barbershop, that niacin, or vitamin B3, could lower cholesterol naturally. He didn't want to take statins. He didn't like side effects. So he bought a bottle online. Each capsule had 1,000 milligrams of niacin. He took 2 a day, every day for nearly a year. At first, he noticed only a warm, flushing feeling in his cheeks. He joked and called it my niacin glow. But over time, the flushing became stronger. He started waking up with pounding heartbeats. He felt dizzy when standing up. His energy felt off. Then one morning, while reading the newspaper, he slurred his words. It lasted less than 2 minutes. But a week later, it happened again with numbness in his left hand. His wife rushed him to the ER. The diagnosis? Transient ischemic attack, a mini stroke. No permanent damage yet, but a clear warning shot from the brain. We looked at everything. No clogged arteries, no major blockages. But his blood pressure? It was spiking unpredictably, especially in the mornings. The likely cause? Niacin. Here's what most people don't know. At high doses, niacin causes your blood vessels to expand rapidly. That's what creates the warm flushing. But right after, those same vessels snap back and tighten sharply, causing wild swings in blood pressure. Over time, this puts tremendous stress on your heart and brain, especially when you're older, dehydrated, or already on medication. Frank was taking 2,000 milligrams a day. That's over 60 times more than what most older adults need. Some niacin products even say flush-free or slow release. But that doesn't always mean safer. Extended release niacin has been linked to liver problems. And flush-free formulas often don't help cholesterol at all, yet still carry risk when combined with blood pressure meds or heart drugs. Frank told me later, "Doc, I was trying to avoid side effects from statins. I didn't know I was gambling with my brain." And that's the hard part. He wasn't being reckless. He just didn't know. Let me ask you this. Do you take any supplements to manage your cholesterol naturally? Have you ever used niacin? Type 1 if yes. Type 0 if no. And if you have a bottle in your cabinet, check the dosage. If it says over 50 milligrams per capsule, talk to your doctor first because your heart is important. But your brain is priceless. Number 6, the quiet vitamin that canceled her medication and caused a stroke. Her name was Eleanor.
84 years old. A retired music teacher from Vermont, she lived alone, kept a tidy garden, and solved crossword puzzles every morning with her tea.
She had atrial fibrillation, an irregular heartbeat that increases the risk of stroke. So, like many patients her age, she was prescribed warfarin, a blood thinner. She never missed a dose. Her doctors checked her INR levels regularly, a blood test that tells us how long it takes your blood to clot. And for years, her numbers were stable, until one day, they weren't. That morning, Eleanor was watering her flowers when her speech suddenly became slurred. She couldn't remember her neighbor's name. Her hand trembled. It lasted about 20 minutes. She had experienced a mini stroke. When we ran her tests, her INR was dangerously low. Her blood was clotting faster than it should, which meant the warfarin wasn't working. We were confused at first until we reviewed her diet and supplements. A few months prior, Eleanor had switched to a new multivitamin. The label said for women over 80. It included 120 micrograms of vitamin K.
Not a massive amount, but enough to cancel out the effect of her blood thinner. At the same time, she had started eating more kale and spinach, rich in vitamin K, because she had read online that leafy greens are superfoods for seniors. She was trying to be healthier, but the combination quietly tipped the balance. Here's the truth most people don't know. Vitamin K helps your blood clot. That's normally a good thing. We need it to stop bleeding. But if you're on a blood thinner like warfarin, the last thing you want is extra clotting power. Your body becomes a tug of war. The medication is trying to thin your blood. The vitamin K is trying to thicken it again. And your brain is caught in the middle. One small clot in one small vessel, and your life can change forever. Now, should older adults avoid vitamin K completely? No, that's a myth. But the key is consistency. If you eat a lot of leafy greens, great. Just don't suddenly double your intake. And if your multivitamin has vitamin K, talk to your doctor. Because even a small amount can make a big difference when you're over 60. Eleanor was lucky. Her symptoms faded. We adjusted her warfarin dose and her diet, but she told me something I will never forget. I thought I was eating better. I didn't know a vitamin could cancel out my medicine. So let me ask you this. Have you made any big changes to your diet or supplements in the past 3 months? Started a new multivitamin? Eating more greens? Comment the number 1 if yes, 0 if no. Your answer might help others avoid the same risk, because when it comes to stroke prevention, stability is everything. Number 7, the memory vitamin that masked a dangerous deficiency. Carol was always the smartest person in the room. 70 years old, a retired court stenographer from Pennsylvania. She could type faster than most people could think. She loved word games and reading mystery novels. Her grandchildren called her Grandma Google because she always had the answer, but for a year, something began to shift. She repeated stories, forgot where she left her keys, missed a few appointments. Then she started struggling with names, Sonny, even her grandsons. Her husband feared the worst, Alzheimer's, and Carol feared it too. So she took action. She bought a memory support supplement. The label said supports mental clarity and boosts cognitive energy. The first ingredient listed, folic acid, 800 micrograms per tablet. She started taking 2 a day. She hoped it would help. Instead, her symptoms got worse. By the time she came to my office, Carol was forgetting simple words. She hesitated before speaking. She walked with an unsure gait. She was convinced she had early dementia. But when we ran her labs, the real story unfolded. Her vitamin B12 levels were critically low. The folic acid had masked it. You see, folic acid and B12 work together in the body, but if you get too much folic acid and not enough B12, the folic acid can hide the symptoms of B12 deficiency. That means your blood tests may look okay. But meanwhile, your nerves are deteriorating. This is especially dangerous for people over 60. Why? because as we age, our stomachs produce less acid. This makes it harder to absorb vitamin B12 from food. If you're also taking metformin for diabetes or antacids for reflux, your risk is even higher. So while Carol was trying to help her brain, she was unknowingly letting her nerves suffer. We immediately stopped the folic acid, started high-dose B12 injections, and began cognitive rehabilitation therapy. She is improving now, but the road is slow. And had we waited just a few more months, some of the damage could have been permanent. Carol told me quietly one day, "I thought I was doing something good for my brain. I had no idea I was letting it slip away." That's the warning I want every older adult to hear. Memory problems are scary, but they don't always mean Alzheimer's. Sometimes it's something as simple as a vitamin imbalance, one that can be fixed just if you catch it in time. Let me ask you, have you ever taken a memory supplement without checking your B12 levels? If yes, type the number 1 in the comments. If no, type 0. And if you've been feeling foggy, forgetful, or unsteady lately, ask your doctor for not just a B12 test, but for MMA and homocysteine levels, because that's where the truth often hides. Number 8, the immunity booster that quietly strained his kidneys and raised his stroke risk. Alan was a firefighter, 79 years old, retired, but still tough as nails. He lived in Montana, chopped wood in the winter, and prided himself on never missing a day of work, even during snowstorms. When the pandemic hit, Alan got nervous.
He heard everywhere that vitamin C boosts immunity. Take more, the article said. So, like many others, he started adding those fizzy immune drink packets to his morning routine. Each packet contained 1,000 milligrams of vitamin C. He often took 2 per day, every day, for more than a year. He felt great until he didn't. First came the fatigue, then a dull ache in his lower back. He started waking up multiple times at night to urinate. Then came the spikes in blood pressure. One morning, he nearly fainted while standing up from the kitchen table. The scans told the story: kidney stress, oxalate crystals, borderline kidney function. What Alan didn't know is that excess vitamin C turns into oxalate in the body, and oxalate forms crystals. Crystals become stones. Stones inflame the kidneys. Inflamed kidneys affect blood pressure, and spikes in blood pressure, especially at night, quietly raise stroke risk. Here's what the science says. The daily recommended amount of vitamin C for older adults is only about 75 to 90 milligrams, yet most immune drink powders contain 10 to 15 times that amount per packet. Vitamin C is water-soluble, yes, but when taken in excess, it doesn't just wash out. Your kidneys can't keep up, especially if you're over 60 and slightly dehydrated. Worse, high-dose vitamin C also increases iron absorption. In some seniors, especially men and postmenopausal women, this can lead to iron overload, which damages the liver, heart, and brain over time. Alan told me, "Doc, I thought I was doing the right thing. I just didn't want to get sick." He wasn't wrong for trying. He just didn't know the danger wasn't the virus. It was the slow damage building from inside. I want to ask you, have you taken immune boosters or vitamin C packets during the cold season? Do you take more than 1 per day? Comment number 1 if yes. Type 0 if no. And remember, real immunity doesn't come from powders. It comes from consistency, sleep, hydration, whole foods, and balanced care. Number 9, the relaxation mineral that quietly dropped his blood pressure and caused a fall. Richard was proud. 85 years old, a Korean War veteran, a retired mechanic from Indiana who still fixed his neighbor's lawnmowers for free. He lived alone, cooked for himself, and managed his blood pressure with medication. He read online that magnesium could help with sleep and muscle cramps, and that it was natural. So he bought a powdered supplement, 1 scoop per night, then 1.5, 400 milligrams, then 600. It helped him sleep, until one morning
It almost took him away. Richard was found by his neighbor on the bathroom floor, unconscious. He had fainted while standing up from the toilet. There was a large bruise on his forehead and blood under his cheekbone.
At the hospital, the CT scan was clear. No stroke, no brain bleed. But his blood pressure had plummeted to 85/50. He had collapsed from sudden hypotension, dangerously low blood pressure. The culprit? Magnesium. Here's what many older adults don't realize. Magnesium relaxes blood vessels. That's why it's often used in sleep aids, calming drinks, and muscle cramp formulas. But in high doses, especially when taken at night or combined with blood pressure medications, it can widen your blood vessels too much, too fast, causing dizziness, blurry vision, and in cases like Richard's, sudden unconsciousness. The recommended daily amount of magnesium for older adults is about 320 milligrams for women and 420 milligrams for men, including food sources. Yet many over-the-counter powders and pills offer 400 to 600 milligrams in a single scoop, and most people have no idea they're overdoing it.
Richard told me quietly after recovering, "I thought I was just helping myself sleep better. I didn't know I was knocking myself down." One fall, one blow to the head. That's all it takes to lose your independence, especially after 60. I want to ask you, have you taken magnesium for sleep or cramps recently? Have you ever mixed it with heart or blood pressure medication? Comment the number 1 if yes. Type 0 if no. And please, check the dose on the bottle. Because the real danger isn't what you feel before bed. It's what happens when your body tries to rise the next morning and the blood can't catch up. If you've stayed with me this far, you've done something that most people never do. You chose to face the truth, not out of fear, but out of love for your future. We've just walked through 9 common vitamins, each with a gentle promise on the label. But when taken in the wrong dose at the wrong time, or mixed with the wrong medication, can quietly raise your risk of stroke, brain bleeds, nerve damage, and even permanent memory loss. Not because you were careless, but because no one told you that after 60, your brain, your blood, your body changes the rules. I've seen too many good people, strong, careful, disciplined people, walk into the ER with slurred speech or trembling hands, never realizing the vitamin they trusted was quietly working against them. But here's the good news. This isn't the end. This is your turning point, because now you know something most people don't, that more pills don't mean more health. And natural doesn't always mean safe, that your brain doesn't need more noise. It needs clarity. It needs rhythm. And it needs you to choose simplicity over excess. So here's what I ask. Before you take another supplement, pause, check the label, talk to your doctor, ask, do I really need this? And more importantly, look at your breakfast, your sleep, your movement, because healing doesn't begin with a capsule. It begins with consistency. If any of today's stories reminded you of yourself or someone you love, please share this video with them. It may help more than you realize. And if you're ready to go deeper into how food itself, not pills, can raise or lower your stroke risk, I invite you to watch the next video. This fruit raises stroke risk after 60. You'll be shocked to learn how one sweet, juicy fruit, yes, one you probably have in your fridge right now, could silently thicken your blood and trigger the very event you're trying to prevent. Because at Dr. Brain, we protect your brain before it needs saving. If this video gave you clarity, please comment 1 to let me know. If not, comment 0 and tell me how I can make it better for you. And don't forget to subscribe so you never miss another moment that could save your memory or even your life.